Okay, so I think we left off here. This is part 2 of chapter 9. Hopefully this will be the second and final chapter or part 2 to this, and we won't have a third one. Um, so I think we talked a little bit about this in the other one real quick, but I'll just reiterate, making sure that everything is clean and well organized. Um, Generally, you're going to have things labeled and you're going to want to make sure that everything is put back in place. If the clinician comes in and makes a mess, unfortunately, it will be up to the medical assistant to make sure that everything is put back where it goes. If there's any prescription pads left out or medications, everything needs to be put back where it goes, even if the clinician is the one that did it. And that kind of goes for any case scenario where you find trash on the floor. The ears, little ear speculums very frequently fall on the ground. So if you ever see anything on the ground, please just be proactive and pick it up, because what the clinic looks like is going to kind of set a precedent for how the patient's overall view of the clinical setting is. So it's important to keep it clean and well organized. Um, as we go into the middle of the chapter, page 180 starts talking about hand hygiene. And so hand hygiene is huge. You'll get this thoroughly and repeatedly, the difference between a regular hand wash versus a sterile scrub in versus an aseptic hand wash. And so kind of knowing the difference between those is important. Um, Page 180 has table 9.2 on it, and it kind of goes through the recommended practices for hand washing as well as the indications for hand hygiene. And it's always better to err on the side of washing your hands rather than going, do I need to do this? If you think you do, it's better to do it. And then there are the gels that are the foams and gels that are on the wall that can be used in between. If you don't have any physical or any physical contamination on your hands, you can use those periodically, but run-of-the-mill soap and water does just the same as well. Okay, so hand hygiene is a priority. It is the primary way that we prevent passing microorganisms in both the treatment area and just dealing with patients. And so that's the first and most important thing to do. Okay, but as well as that, we also need to make sure that our exam table is kept clean. And that we disinfect all the work surfaces. Generally, you're going to do that before and at the end of the shift and beginning of the shift and the end of the shift. The examination table really and truly should be cleaned in between each patient. Almost all tables are going to have a paper that lines it, but the fact of the matter is the paper does not cover the whole table. It does provide a little bit of a barrier. And so if there's any possibility that fluids or contaminants go down there, you have to disinfect the table as well, not only before and after, but possibly in between patients as well. When you're folding up the exam paper, it's important to make sure that you fold it inward and roll it into a tight ball and do it kind of quickly. If you kind of flap it around and don't, then there's the chance that microorganisms could get loose in the air. So you just want to, there's a picture, they talk about how to fold it on page 180 as well. So you just want to make sure you fold it inward and fold it quickly and into a tight ball. And then make sure, generally, as long as it doesn't have any contaminants on it, blood or bodily fluids, you can throw it in the regular trash. So once again, I'm not going to go too much into infection control. Professor Luria will more than cover this in your infection control class. But once again, your hand washing, warm soap and water works, but you can use the alcohol-based hand cleaners that are posted on the wall. We have them in our classroom, and all clinics have them. And so in between patients, you can occasionally do that unless you are doing a procedure, and then the full hand washing is recommended. Okay. The examination table, we talked about that. You have a paper cover and you have linens. Most of the ones, because if there's a high volume of patients, you'll usually use paper linens, which will be thrown in the regular trash unless contaminated with body fluids or blood. Some places might still have cloth linens. Some places might use that. And so depending on where you're at, you might actually have to do a wash service. But primarily high volume clinics are going to have some form of paper linens, to where a hospital might have cloth linens. Okay. Disinfecting surfaces. Once again, there is that table on page 179 that talks about the different disinfectants. Any surface that is visibly contaminated with tissue, blood, or other body fluids needs to be done at that given time. You're generally going to do it at the beginning of a shift and the end of a shift, but anytime there's visibly contaminated tissue, blood, or other body fluids, you must completely disinfect that surface. Okay, you'll have to go by what your office schedule is, but that's very important. Okay. Storage, you got to store biohazardous specimens properly. Once again, you will go through this in infection control. There are certain testing kits that have to be stored properly. There is a page that talks about refrigerator temperature control on 182, and there's certain things that have to be kept at a certain temperature. Generally, the temperature of a room is going to be about 72 degrees, but that page talks about refrigerators and where the refrigerator temperatures need to be kept at. Okay. Okay, now remember we talked about making sure all items are put away where they go. Once again, even if the clinician makes a mess, it is the medical assistant's job to clean it up. Don't ever leave anything in the hallway that someone could trip or run over. If there's a box or something, you have to call someone to make sure it's moved, because that could be a physical hazard. Housekeeping, a lot of places will have housekeepers, but in essence, that's going to be the medical assistant. So you must pick up any trash, anything that's on the ground. Don't wait for someone else to do it. Be proactive and do it yourself. Okay. Okay, so there is a section that talks about temperature, lighting, and ventilation in the rooms. Most of the time, you're going to keep room temperature at about 72. Some clinics the rooms may allow you to adjust it. Others might be controlled by a central controller, so you might not have any control over it. Drafts can be big, and so you have to be careful. There are some uh, some things will cause a bad odor to occur. Diapers and trash cans. Most pediatric clinics will specify not to put a dirty diaper in the trash can, and will say to give it to someone so they can be disposed of and not left in the trash can. As well as vomitus or urine or other bodily things might be an issue. So generally, when you're looking at those, you're going to have to eliminate your source first. If someone does vomit on the floor, the best thing to do is to try to ventilate first, find whatever chemical it is or whatever cleanup method is in your facility, clean up the mess first, and then there's usually certain sprays for odors like orange peel spray, lemon peel spray that can be used to kind of help take care of those malodorous situations. Okay. Lighting, please make sure that you have a working light in every room for extra lighting, not just the light from the switch on the wall, but an extra lighting source. It's important because many times that extra lighting is needed to look at a rash, to do a procedure. So please check the bulbs every day. I've had case scenarios where I go to do a gynecologic exam and I go to turn the light on and the light bulb is blown. And so it's important to make sure you check your lighting source every day, make sure it's plugged in, and make sure the bulb is not blown. Okay. And then we kind of already mentioned ventilation. You have to eliminate the source of odors. Another bad source of odor is also a retained tampon. So if you're in a gynecologic setting, that is one case scenario where the clinician might come to you and say you have to get rid of your red bag because I had a retained tampon, and they do smell rather strong, and so that is something that has to be taken care of right away, and you can't wait. Okay. Okay, so make sure you kind of review those few pages that talk about room temperature, lighting, and ventilation. They're on 182. And then what we'll kind of do is just go over some of the basic. This does a pretty good job. The book 183, page 183 and 84 and 85 kind of go through the different kinds of supplies. It will kind of fall down on the medical assistants to order and stock all the needed supplies. Generally, if you're working out of 2 rooms, it will be your responsibility to check all the stock in the room. That could be tongue depressors, extra gauze, medicines, speculums if you're in a gynecologic setting. And so it's important to make sure that everything in the room is kept stocked. If a doctor or a clinician or a PA or nurse practitioner go looking for something and it's not there, then they have to leave the room to go get it. It can be difficult. And so part of the job, and it takes time to learn this, you don't have to know everything right off the bat, but learning what's needed, making sure you're familiar with your room, know everything that particular room supplies so that you can make sure it's always there. If somebody has to leave the room to get something, it can disrupt the flow of patients. So making sure that your room is stocked, and become familiar with the things that need to be ordered, because if things get low, it might be on you to keep track of that and make sure that those orders get put in as well. Okay. Um, there's a table, table 9.3 on page 185 goes through and lists the different instruments, talks about sanitation, disinfection, and sterilization, and then it kind of shows the guidelines for it and then the instruments that go through that process. So please be familiar with those. And then once again, it'll vary depending on where you're at, how something or what chemical is used to sanitize something versus disinfection versus the sterilization. You guys will go through and autoclave instruments, and you'll learn how to package them and go through the autoclave process. So that will be taught, that will be something you go through in infection control. But that table kind of gives you an idea of which common instruments and what level they need to be cleansed at. Okay. So this next two slides just kind of go through and talk about the different instruments. So we'll go through this in class, and you'll see a lot of them as we go through things. And it's just going to be important to just kind of know what these instruments do. So this will be part of the exam. There will be part on here just kind of knowing what each instrument, you'll need to be able to identify it by looking at a picture and then kind of know what it's used for. Okay, so an anoscope, it kind of looks like a vaginal speculum, but it is slightly different. And it is used for basically rectal exams or any type of exam of the anal area, whether or not you're doing hemorrhoids or checking for a fissure or a fistula or something like that. So an anoscope is used probably not as much in primary care, but definitely if you are in a gastrointestinal specialty. An exam light actually provides additional lighting, and almost every room will have a different form of exam light. Some are very large, others are smaller. But once again, you always want to make sure it's plugged in and that it's working and that the bulb is not blown. A laryngeal mirror kind of reflects the inside of the mouth and throat. This is more common in an ENT setting, ear, nose, and throat. A primary care might have this, but basically it functions to reflect areas of the mouth, throat, and possibly farther down in the laryngeal area. Nasal speculum is used to enlarge the nose, and that's more common in an ear, nose, and throat setting as well, but you'll probably find those in the ER. The child gets something stuck in their nose, which does happen periodically. Sometimes they'll use a nasal speculum to help remove it. The ophthalmoscope and otoscope are very commonly used by primary care providers as well as specialists. The ophthalmoscope is used to examine the fundus, which is the inner surface of the eye, and then the otoscope is used to examine the outer ear and inner ear. And so there's a head on the handle that can be interchanged, but we have both of those mounted on the wall. Pen light is just a small source of flashlight that can be used. Some people carry that, not always. Reflex hammer checks the patient's reflexes. Primary care as well as neurologists will carry that. Sphygmomanometer is actually the blood pressure cuff, and so that's the official term. And so if you see that, you can't just say I'm looking at a blood pressure cuff. You have to know that it's called a sphygmomanometer. Okay. Stethoscope, you guys will hopefully be carrying one of these and using these frequently. It's used to listen to body sounds, and we'll go over the different body sounds that can be used. Tape measures are often used to measure the fundal size, the stomach of a patient that's pregnant, or a rash, or circumference of a body part. Thermometer, we will go through extensively the different kinds of thermometers that are out there to measure body temperature, so you'll get a chance to see the different ones. A tuning fork is used to a couple of different hearing tests, but you can also use it to test vibration. And then a vaginal speculum is used to enlarge in the vagina for specimens from the cervix and the vagina. We'll show you a few of those as well. Okay. So these just kind of give you a little summary of the different supplies for a general physical exam. Some of these are consumable, some of these are disposable, and that's kind of talked about on page 185. We'll go through these in class a little bit and talk about them, but it will be important to kind of know the difference between disposable and consumable products, which they talk about on 185. Okay, and there's a little bit of the information here as well. Okay.